So I'd like to first off welcome everyone to the third in the Vermont Public Health Association's series of 3 career panels that we've done over this academic year. First, a little bit about Vermont Public Health Association. We are a state affiliate of the American Public Health Association, and we strive to be a home for public health professionals, students, and community champions here in Vermont. We have 3 different pillars of our focus of our work. We really have a strong focus in education and advocacy and policy at the Vermont level, and mentorship, working with students, interns, and young professionals. So this obviously fits in that third category for us. And I'd love to just take a moment to briefly introduce our panelists. We have 4 really fantastic panelists today. Given so much of the uncertainty that is, I think, racking a lot of the public health profession, we thought that it would be good to try and ground our discussion today in a realistic look at what is the public health career landscape looking like these days, and to get really strategic in terms of like, what does that mean for people who are trying to enter the public health workforce. And so to that end, we have 4 fantastic speakers. Jay Basiliere is going to kick us off. Jay is the Public Health Workforce Director for the Vermont Department of Health. We have Michael Leyden from University of Health, UVM's Health Network. He's an EMS Training Center Manager. We'll be joined momentarily by Noah Barclay-Derman, who is a lecturer at the University of Vermont's Public Health Sciences program. He's finishing up a class right now, and he's running over to his Zoom, now Google, call shortly. And last, Evelyn Gearty from the Vermont Community Foundation. So to kick it off, Jay, can you start us, please?
Absolutely, and thank you so much, Dan, for inviting me to participate in this conversation. My name is Jay Basiliere. I use they, them pronouns, and as Dan said, I'm the Workforce Director for the Vermont Department of Health. And so I have 2 seemingly conflicting messages to share with you today that I hope I'll be able to bring into alignment. The first is that governmental public health is awesome and we want you to join us. And the second is that there are some unique challenges that people who are just now entering the public health workforce may be facing. But let's start with the great stuff. And I think I wanted to sort of introduce my pitch by telling you a little bit about my job. So public health is actually a career transition for me. I started professionally in higher education, first as a professor, and then I did a couple of years in higher ed administration. And I, in 2023, started looking for something a little different and kind of accidentally stumbled into governmental public health. I am in a role right now with the Vermont Department of Health where my exclusive charge is to make our workplace as trauma responsive and accommodating for our staff as possible. After the first kind of year and a half of the COVID pandemic, the CDC did an environmental scan of the public health workforce, and they found, unsurprisingly, right, a lot of trauma and a lot of burnout from just kind of sustained participation in a public health emergency, unlike one that has happened in any of our lifetimes. And so in response to that, the CDC created what they call the Public Health Infrastructure Grant. And part of the conditions for receiving this infrastructure grant was that every state and most county and municipal health departments in the country need to have someone on staff whose sole job it is to focus on staff well-being and staff development. So I get to go to work every day and think about how I can make things easier for the absolute rock stars who work in public health. And this is all public health. Like, it's not just governmental public health where there are rock stars, but I only get to work with the rock stars at VtPHA generally. So it's great to work here. This is the best job I've ever had. I want you to come be in this great environment as well. And there are some sort of very unique challenges that we're facing right now that I feel like I need to be honest with you about. And the first is that our work is deeply reliant on access to federal funding. And so far, we have had some funding, some loss of access to federal funding. It hasn't been catastrophic yet. We're doing okay. But there's also just like a big question mark. We don't know what changes to our access to resources will come in the next month, in the next year. So it's hard for me to give you a real prediction in terms of what our available positions might look like when you are coming onto the job market, because there's a lot that's unknown and a lot that's outside of our scope of control. That being said, right now we are forging ahead business as usual. We are doing our work. We are doubling down on our internal commitment to centering health equity, and that is not something that we anticipate changing. It is one of our core values as a department, that when we say we want all Vermonters to be able to achieve their optimal level of health and well-being, we really mean all Vermonters. And so I'm very proud to be able to share that we will not be wavering from our sort of framework of what public health is, which is inherently a mode of practice that involves being attentive to the kind of various needs that people have based on the identities they hold. Another additional piece of context I can share about what available positions with our department might look like in the future is that we are currently a workforce that skews a little bit older. So 14% of our workforce is either currently retirement eligible or will become retirement eligible in the next year. And obviously we are not here pushing people out the day they become eligible for retirement, but it is, I think, reasonable to expect that we will, and those numbers kind of continue. If we look at our 5-year trends, we're seeing a kind of very steady march of staff who will become retirement eligible. And it's reasonable to expect that we will see some attrition through retirement, which will create new positions in our department. So even though I can't stand here right now and tell you that everything is super great and we're flush with cash, we are at this point moving forward as normal, and we will just respond to changes in our access to funding as they come. And so then the last thing Dan asked me to touch on, I think I still have a few minutes left, right, Dan? I didn't exactly check the clock, was
You're great, Jay, thank you.
Advice for folks who are just now coming onto the market. And what I really want to say to you is that I advise you getting really clear on the skills you have, the kind of, we used to call them soft skills. I don't love that language, but the kind of cross-cutting areas of capacity you have. And I think that is going to be really important as you're looking at jobs, particularly as you're looking at the minimum qualifications for a posted position. I think it's easy for a lot of us, particularly for folks who were socialized as young women who are kind of overrepresented in public health. I think it's very easy to kind of underestimate your qualifications. And I just really want you to remember that your degrees have given you marketable skills that we want to have in our workplace. We want you in our community. And so as you're out looking, it's going to feel discouraged. It may feel discouraging. Like, hey, welcome to this career panel. You're going to be discouraged. I don't mean to come off like that. I just mean that the job market is hard across the board right now. This position I'm currently in, I was hunting for it for 7 months. It may at times feel overwhelming, but I think it's so important that you stay centered in the fact that you have the skills we want, you are ready to come into this workforce, and we're really excited to help you find the right fit for you. So I think I will stop there and pass it off to the next panelist, but I would love to answer any questions you have during the Q&A at the end.
Jay, that was fantastic. Thank you so much for sharing those insights. And I think you went right down the middle there between the inspiring and scary. Probably a good reflection on where we are right now. Let's turn it over to Mike with the University of Vermont Health Network.
Thanks, Andrew. I'm Mike Leyden from the University of Vermont Health Network, and happy to be here this afternoon to talk with you all. It is a tricky time, obviously, kind of goes without saying. I liked Jay's closing remarks there about kind of dialing in on, what your skills and attributes are, and really to help you stand out potentially. So I'll have some more thoughts on that at the end of my spiel here too. So my current role, so I've been with the Health Network in some capacity for 8 years, and I've had several roles, including some sort of frontline work, sort of in the trenches of the emergency department, so to speak, and various administrative roles. So right now I am trying to stand up and lead a workforce and training center that targets our EMS workers. So our EMTs, paramedics, people like that. So the University of Vermont Health Network actually owns and operates several EMS entities. So we do both in Vermont and New York. The Health Network itself, for those of you that may be less familiar, so we are a large, complicated, integrated healthcare delivery organization, right? And so we operate a total of 6 hospitals, 3 in New York, northern New York, and the Adirondacks largely, and just west thereof, and 3 in Vermont. Our hospitals range in size from critical access hospitals, which is a specific designation for rural hospitals, capping them at 25 overnight inpatient beds, basically, and then all the way up to our tertiary care academic medical center in Burlington, the UVM Medical Center. And we also have a home health agency along with the EMS agencies I mentioned. It's a big outfit, right? So we have over 12,000 employees, depending how you kind of count them and sort them. We, among the hospitals, have 800 to 1,000 patient beds, depending how we staff and configure them. The UVM Medical Center in Burlington has the tertiary care hospital. The catchment serves 1 million people, give or take, just for that one hospital because of that tertiary care model. And overall, we're covering arguably a couple million people kind of from the western frontier to the eastern edge. And we have overlap with other tertiary care partners. I started actually at Porter Medical Center down in Middlebury, which is one of those critical access hospitals I mentioned, so in more rural Addison County. And I actually came there from VtPHA. So I spent a number of years at VtPHA and then kind of made a pivot out of a state governmental healthcare public health agency down to the healthcare delivery side. So that's a little bit about our health network. Our health network is also increasingly waded into the kind of complicated and evolving waters around what on the healthcare side we tend to call population health. But anybody walking around with an MPH is going to recognize this, wait, isn't this just public health? This is what we've been doing all along. So I always have these kind of tussles with some of my medical center colleagues around what is public health versus population health. And my interest to move into the healthcare side really came out of time I spent in emergency services that led me to emergency preparedness and emergency management. So kind of a side door way to get into public health. I had started my career in EMS and worked as an EMT, eventually became a paramedic, did frontline patient care as a paramedic, moved into leadership roles, working on quality and education, and somehow finagled my way into an international assignment. So I ended up helping run an EMS system in a foreign country, down in Trinidad in the Southern Caribbean. Their whole healthcare delivery system as a former British Crown colony was sort of UK style. So like the National Health Service of the UK, public health, model. And so the healthcare delivery system was similarly public-based, including the EMS agency. Did that for a couple of years and rotated back to the US and went, I often say, kind of jokingly, but also really seriously, went and got the degree I should have had before I went, which was an MPH in global health. So I kind of did them backwards, but kind of doubled down on the broad foundational education you get in an MPH program. And so I think, to follow up on Jay's point, that, despite the swirl, everything happening, all the uncertainty, one of the benefits of a public health education is, and an MPH in particular, I feel, is that it really anchors you at your abilities to analyze and solve problems and talk about a transferable skill set, like being able to really wrap your head around complex problems and really chew on things and think on them from a lot of different angles and perspectives, from technical expertise and knowledge in statistics and epidemiology to really getting on the right pair of lenses to think about equity and all of its complexities, and really everything in between. That's, I think, an anchoring skill set for anybody with an MPH, even if you've subspecialized, whether you pick global health or you really like the numbers and you become a biostatistician. I think there's an anchoring component there that's really useful. So, my side door entry to public health was really interesting, and what drew me to it was around this idea of systems thinking. So not just really sort of analysis and problem solving, but really trying to roll things up into a systems perspective. And that's what's really kept me anchored in the UVM Health Network as we've grown as a network. When I actually started at Porter, it was still an independent. So I was there for a year, and Porter was a 90-plus-year-old independent small rural hospital, of which we had many in Vermont. And I went through the process of becoming part of a big functioning network. And now I'm actually in a true network role. So my role is at a network department that's titled the Care Coordination System. And we try to do some big picture work across the entire sort of span of the health network. And that's been a really interesting experience because you're working in a almost government level sort of bureaucratic, layered, sophisticated system, but in a private sector context. And of course, when I say private sector, it's important to remember that the health network and its entities are nonprofits technically, right? So one of my former colleagues, when we think about our healthcare delivery in Vermont, which is also under a lot of stress, he's the CFO for 2 of our critical access hospitals, likes to remind us that, no margin, no mission. So if you don't have a positive margin on your books of, our targets run around 3.5% for those smallest hospitals, your opportunity to reinvest in your hospitals and your infrastructure and your network and your pop health work is really diminished. So there's a lot being said right now across in Vermont in particular about the cost of healthcare. And there's a lot more to continue to be said and worked on that front as well. I think to pivot slightly over to some of the attributes that I think I've both found useful and sort of sought out, but also maybe really relevant for job seekers, particularly those that may want to come into healthcare as a venue. I think that, the foundational education of MPH, super valuable, as I mentioned, and working to accrue more skills beyond that. And some of them you can pick up on the way. Many of them you pick up through your professional career. But I'd point folks towards a couple areas. So, within healthcare and the healthcare delivery side, there are so many ways you can apply and use this knowledge and skills of somebody with an MPH. It's a deeper rabbit hole to go down than we have time for. But just a few examples. I've encountered folks with MPHs that work in infection prevention and control, that work in occupational health, and in healthcare facility setting is a very specific type of occupational health and safety, really. Population health, as I mentioned, so everything on from thinking about the difference between low value care and high value care, both in terms of the clinical care that's delivered, but also the settings or the context in which the care is delivered. All kinds of elements around quality, including the sort of biostatistics of quality and the markers and metrics of quality and how that's sort of monitored. All things sort of equity, social determinants, many of the same things that overlap with work done daily at VtPHA actually covered in the health network as well by sub-teams. The regulatory environment that healthcare delivery happens in, if legal is your thing, you love standards in legal, there's a whole pathway down that as well. In terms of other skills that I think are really valuable, even beyond just healthcare, monitoring and evaluation, really getting savvy in your monitoring and evaluation skills is broadly transferable to a lot of different employment settings. Grant expertise, pursuing grants, writing grants, doing the follow-up necessary to manage grants. Right now, I'm kind of helping shepherd $1 million in grants, which is not much, but it kind of is the seed money to start our training center in partnership with UVM. So it's not all on the health network side, it's actually in partnership with UVM. And there's, of course, now you've got two bureaucracies combined together, and you need to be able to navigate that. And then overall leadership trainings should be a part of your kind of lifelong pursuit portfolio of education. A couple specific, if you want sort of harder skills, so to speak, they're still in the people domain because that's what we do in public health. I have taken some great courses through an outfit called ProSci around change management, a really good change management organization. Project management professional credentials are great. There's various flavors of those to pick up along the way. Even things like Six Sigma, which we think about almost more in the kind of business lane, really important for operations management and leadership. And then there are specific programs around healthcare quality that are a great thing to marry with an MPH degree. If you really decide that clinical care is what brought you to the MPH programs, that's another great venue to kind of pursue. So I think I'll leave it there for now. I'm happy to take questions as we go.
Mike, thank you so much. That was a great perspective to add to the discussion. We'll turn it now over to Noah, who was able to join us after just finishing up the class.
Hey, wonderful. Thank you for having me, and glad to just get here. And real quick, I guess I also want to make sure we have time. So I'm a faculty at UVM in the College of Nursing and Health Sciences in the Public Health Sciences program. And our program is a CEF-certified undergraduate program with the courses aligned with the National Learning Standards. The Public Health Science program takes a population-level approach to confront health issues, both locally and globally, hopefully giving our students skills to work in improving access to healthcare, preventing and controlling chronic infectious disease, advocating for underserved populations is a big part of it, communicating during crises like what we saw with this pandemic, and really understanding and confronting the social determinants of health. So our stated mission is to strive for health equity by preparing the next generation of leaders to improve the health of individuals and communities through basic science. But we have our unstated mission, which is just knowing that many of our students are going to go into different clinical settings, PAs, nurses, NPs, doctors, therapists. We've had many students who have taken our undergraduate public health program and gone into law school or business school or health administration. So we just want to make sure that everyone leaves with just the basic understanding of public health and a social justice lens, and make sure they're looking upstream at the true drivers of health. So that's kind of our unstated mission. So don't tell anybody. And then when the next prompt that we had was thinking about my educational background and getting jobs and skills and competencies that have led to success. And one thing that I'm very cognizant of is kind of the time of life of many people at the time of looking for new jobs. And I always tell all my advisees this, that my formal undergraduate academic background was in Chinese and creative writing dual major. And I was imagining my career as being a poet in New York City. And so that as we get going and as we go throughout our life and different career opportunities, there's just so much room and growth and change that happens throughout our life, and opportunities show up in different ways. So after my undergraduate, I ended up going to work as a Peace Corps volunteer in Thailand, and started really diving into what it looks like for global health work. And really, I ended up getting involved with and working with people living with HIV/AIDS support group. That was that. And I guess I just want to share that because I think when we think about where our career is going to go and how to enter that, that it's often a very windy path to figuring out where you land up and end up working for many people as they enter into different careers. So I wanted to I ended up learning and doing a lot of work around HIV and realizing that I wanted to know more and get more of a professional background in what that looked like. And so after working on a local level with my neighbor and learning about what HIV support looks like and care and treatment and counseling in Thailand. I then ended up working with a district level and then a provincial level. And then I was like, I need to go get my MPH and really start understanding on a deeper level. And so I went into getting my my MPH in global health and just had this amazing cohort of people coming into global health from all different perspectives in global public health, from working at local health departments to being MDs, working in law. And we all came together in a cohort around a global community that really felt like we need to address some of the global health equities that we see. And so some of those skills around what that looks like, or at least what it would look like in my experience, was using a lot of these transferable skills that you get from even an undergraduate public health program, but also definitely an MPH, around kind of program implementation. I ended up having to do and have done a lot of monitoring evaluation, understanding infectious disease, grant writing, project management, development, and a multitude of different skills that end up really being applied for it. And I guess one thing that I learned during my Peace Corps service that I really put myself and made myself do is that no matter whether in a meeting or in a community event or in conversations, was pushing myself to just stay a little longer than you want to. And that's where a lot of really important networking can really come out of as well. What has motivated and still inspires to work in the field of public health? I mean, really just looking at the state of our world right now, and the longer that I work in this field. So, I've worked with different international nonprofits, as well as the CDC and now at UVM, is that the longer I'm in this field of public health, the more important I think it is, and the more needed I think it is for both workforce development and just understanding of what is public health and how important it is for the health of all of our Americans. And really thinking about what is actually driving, our poor health, and understanding the difference of what healthcare is and what actually impacts our health, and thinking through the combination of all of that. So we're really addressing issues upstream. And through that, the colleagues that I've had who have been, worldwide, from Thailand to Zimbabwean to Ghanaian, just all over the world, have really been in concert and thinking about what I envision and value in our world is this kind of global collectivity on thinking about the core values of what we believe it is important. And that's really the care and the health of humanity and humans, right? And thinking through how do we create more ethical and more health equity around the world. And so I think just kind of thinking about how important that connection is has really been what's driven me there. And then thinking a little bit about job searches and that kind of next step. So I'm really taking this from kind of working a lot with soon to be, graduating seniors, some who are going directly into the workforce and others who are going into grad school to then go into the workforce as well, is to just be okay to fail and don't be afraid to be rejected. I think that if you're not putting yourself out there in certain situations or feel like, being afraid to be turned down is only going to hurt yourself in the position. And then also making sure that you don't sell yourself short, and that you truly actually articulate all the skill sets that you have. And don't assume that just because you got a Bachelor of Science in Public Health that people are actually going to know what that means and what you studied, and really be clear on what you've learned on looking upstream to solve complex problems, or conducting a program evaluation, designing a project, submitting a grant. All of these skill sets that, many of our students have had during their undergraduate experience, just making sure that they really are articulating that as they apply for positions. Another thing we talk about is that often 80% of jobs are not listed openly. And so that means those jobs are made through connecting with contacts, and that, to really not be afraid to use your social network to connect on all things related, because you just never know where a network and a connection could really bring you into an amazing opportunity, a great job of the workforce. And then just two more quick things, and then I'll be done. But just thinking about that the timeline for applications is often different than the timeline of the applicant. And so as you're, thinking about jobs, understanding that, it takes a while. And, even if you do happen to get the first job and enter the workforce with your first opportunity, the timeline is very different in kind of how you feel and the need for a job versus the wait time. And then last, just like the first impressions really matter a lot. And so don't sell yourself short, be responsible, and kind of how you appear, and really think through kind of those connections. And if we're all here in Vermont, we're all just, 1 degree separated. And so the same people you see in the grocery store or, at UVM will be the same people that you might be applying for a job when you go enter in the workforce. And just thinking about how you carry yourself and those connections is actually very incredibly important. So I'll just say that and then leave that there. Thank you.
Great, thank you, Noah, and a hugely important, I think, topic you just touched on there in terms of the active networking, to make sure you're making those connections and helping your resume kind of stand out from the pile by knowing folks. Really, really important point. Thanks. And I'll turn it over now to Evelyn, who's our last speaker, and then we'll have some time for Q&A. Evelyn.
Thanks, Dan. Well, so far this has been super helpful for me as a young professional. I graduated from UVM with a bachelor's in public health sciences in 2023. And so just to go back a little bit, I started my college career at a different university, and I was studying nursing at the time. And then COVID hit, so we were hit with a big public health challenge. And I ended up transferring to UVM into the public health setting. And my intention from the get-go was to go into something clinical. But I caught the public health bug and wanted to do something that was more program-related upstream. And yeah, a lot of that is thanks to folks like Noah and the other members of that team. I took one of Noah's classes. I think it was epidemiology in the midst of COVID, so that was really fun. But anyway, I'm now 18 months from graduation, and I am working with the Vermont Community Foundation. I've been with them all of that time, pretty much. And I work on the community impact team. We do a lot of managing of partnerships, grant making, and I have a particular focus on health and well-being in the state of Vermont. And so a few different pieces that I've found have been really important in terms of skills are writing, grant writing, understanding grants, grant management, all of those pieces. And then project management. I worked closely with a colleague on managing some grants to community organizations through VtPHA, which was for health equity, which was really a great experience that I was lucky to have. And so the Community Foundation is such an interesting organization. We have sort of two sides of things. We inspire giving and bringing together people around resources to make a difference in Vermont. And so there's both like the donor fund holder aspect and then the giving to the community organizations on the ground. They're really doing the important work. And we have an opportunity gap sort of mindset where we have impact areas, economic equity and mobility, education, training, climate and environment, health and well-being, democracy, trust, and local media. And when I saw those before I interviewed, I thought, oh, those are basically the social determinants of health. And it was like this, you know, philanthropy is not necessarily traditionally a role that you consider to be public health. But in my mind, I was like, this is kind of public health. And I feel like I've gotten a lot of really great experience so far. And I will eventually go on to get my master's in public health and all of that. But this is such a great foundation to build those skills that I mentioned that are so important in roles in public health and that other panelists have mentioned so far. And so I'm going to share a little bit about the process that I went through in landing this job and just my job search in general post-grad. I didn't really know what I was doing, as many post-grads feel like, at least. Maybe I knew more than I thought I did. But especially in my generation, I feel like most people start online looking at different positions that might be open and on LinkedIn or on the state website, city of Burlington website, other organizations, just clicking on that little career link and seeing what available positions there are. And that is great, but it only goes so far. You can apply, but if you don't know somebody, you don't have a warm welcome or something like that, it often, at least in my experience, doesn't go super well. I applied for a few of those roles and got rejected, and that's okay. And then I moved into a lot of networking, talking to professors, TAs, former coworkers or employers, family, friends, and that opened some doors. I took a class that has a research component in the emergency department and sort of took a moment and was bold and was like, are there any positions that are going to be available after I graduate at the emergency department, which was really nerve-wracking. But that also, I was offered an opportunity, which I didn't end up taking, but nonetheless, was a great opportunity. And so, yeah, my biggest piece of advice there is to network. Everybody knows everybody in Vermont, I've learned after living here for 5 years. And so VCF came to be through actually talking to one of my professors who had been at an event, and an employee at VCF mentioned that there was this position available, which is a position that's built for postgrads. It's a fellowship. And I looked into the position, and it was 10 days past the deadline. And I was like, well, I don't know. I don't think I'm even going to try. But I ended up calling the contact that my professor had at the VCF for an informational interview. And just to learn more about the community foundation, I figured it couldn't hurt. And he suggested that I apply anyway. So I applied anyway, and got an interview. And it was an intense process. I had 5 interviews. So I think it's also got to be patient. And if it's meant to be, it'll be, which is super cheesy, but true. It took a lot longer than I expected. And the timeline, as sort of what Noah said, wasn't what I was expecting. You know, start date was probably sooner than I wanted. I know for many it's later than you want. But it's important to be flexible if you feel like the job is right for you. Yeah, and then just I want to echo what others said, which is don't underestimate yourself. Make sure that you talk about what skills that you have, and especially for women and non-binary people, when you're looking at a job application and there's skills and you're like, oh, I don't really know if I know how to do that, or if I'm like competent enough at that, apply anyway. You'll learn, and you're probably better at that thing than you think that you are. Yeah, that's sort of what I got, but open to questions.
Great. Thank you so very much, Evelyn. Love to hear your story of how you ended up where you are. Why don't we take a moment to open up to questions from the group? So you should have the ability to unmute yourself. I'm not a Google Meet person. I'm usually a Zoom guy, so I'm not going to manage this too much other than take yourself off mute and ask a question if you have any for our panelists.
I'll jump in. I don't see anyone else coming off mute. Can everyone hear me okay? Okay, great.
Yep.
Hi, everyone. Great panel presentation so far. Thank you so much. Really valuable. I'm Molly Lawrence, she, her, and I'm with the Vermont Public Health Association Board and UVM Health Network Community Health Improvement by Day. So nice to meet you, Mike, virtually, and hear about your work. I'm curious, as we, and many of you touched upon this, but we're navigating uncertain waters in public health, and I'm curious, one thing that's bringing each of you hope in navigating the public health community and opportunities in Vermont. And thank you again for your excellent presentations and insights.
That's a really easy question for me to answer, so I'm happy to chime in first while others think. This may sound so trite, but please, I mean this from the bottom of my heart. My colleagues give me hope every day. People don't come to executive branch work to get rich. Everyone I work with is here because they align with our mission, because our values resonate with them, and they're a really, really delightful community of people to be around. So even as things become hard and scary, I sleep well at night knowing that there are beautiful humans who are continuing to do the work and who are gonna hold each other up when things get hard.
So I think that adversity can drive and foster new thinking and innovation. And we saw the pandemic is certainly a place for this. It also sometimes lays bare things that are in need of having the flashlight shown upon them, right? So again, the pandemic, huge amount of inequity in the healthcare delivery system in terms of access and other dimensions really became crystal clear. The other thing that I've been thinking about, and it's not necessarily in the full-on inspirational category, although I will say, and I think Molly, you probably feel this too, I still work for our health network because of its mission, vision, values. We are staying the course, and I really, if we weren't, I would not be here, I think, in the same way, showing up. But the other piece I've been thinking about is, what does the other side of all of this turmoil look like? And in particular for this audience today of young and upcoming people, we will need to figure out how to rebuild and recover many of the things that are being wrecked actively. And our recovery can't be passive. It needs to be equally active or even more so. And of course, when you rebuild, sometimes you get to build back in a new and better way. And so there's that opportunity for innovation and thinking about how it is we're actually going to right size things and fix things. Efficiency is always a challenge in all of this work, but that's something I've been thinking about.
Yeah, I agree with kind of what Mike just stated, and having been through the first Trump administration and also then through the pandemic in different ways, and at different points, running a nonprofit during that time, I was amazed at kind of the other actors who also stepped up in those times too, and really showed the importance and value of what was happening, and not to fill in the whole gap, because we need the federal government in so many different ways, but just how much care and need for this type of work and recognition of it. and how important that really is. And then the other thing that really gives me hope and has for the past 4 years that I've been at UVM is really the students, both their optimism, their care, and their perspective of how they think through public health is really inspiring for me. And the seriousness that people take that and think through these really complex, dynamic issues that we're going to face as a nation is inspiring. And like that next generation really is coming at this from a really strong set of values and a really strong framework.
We work with a lot of community organizations that are doing such important work at this time for HIV treatments and for gender reaffirming care, refugee resettlement, all of those things. And it's just really inspiring to see these organizations stand their ground, even though they're facing a lot of hardship with federal funding cuts, and to be able to partner with them and at least try to support them through this. Private philanthropy that cannot fill the gap of federal funding, but we're trying. And that's really inspiring to just be on a team that's trying to think through how we solve this really, really big problem.
Great. I see we've got a couple of hands raised. I think we're all going to go in Pam, then Sally, and then Cynthia. So Pam.
Yeah, thanks, Dan, for organizing this. And thank you to all the panelists for all the great information. My question for the panelists is, I'd love to hear your thoughts about how important an MPH is, and specifically sort of at what point in your career. Because a lot of students ask me sort of, what's better now or later? And I can think of arguments, for one or the other, but I'm curious to hear what you all say based on your experience and colleagues that you work with. Thank you.
Are we just keeping the order? If that's easiest, I'm happy to do that. Okay. So because I'm going first, I can't pull up exact numbers, but I am just as like a rough ballpark going to say that about a quarter to a third of our staff have an MPH. So it's certainly not a requirement for us. We have many people who come in with a bachelor's degree and then use our state's tuition assistance program to get their MPH while they're here, which I think is just personally speaking only for myself, is a great fiscal choice because you are able through state programs to apply for up to 90% of your tuition to be covered for a master's degree. So every semester we have 3 or 4 graduation announcements, and that's always an exciting time. I think that it can maybe be an advantage for some specific types of positions in that the MPH gives you kind of additional experience with some of the things that Mike and others have talked about in terms of learning about grant administration and moving systems change. But I would say it's certainly not a requirement. And I think for a lot of people, it comes down to a matter of personal preference. Do you want to enter the workforce and then sort of do your degree more slowly, or do you want to get it all done in one go and then hunt for a job after that?
And just so we can get to our other 2 questions, maybe one other panelist could, if you want to chime in on that. And Evelyn, can I put you on the spot? Because I know that you said that you were planning on going back. Would you be able to share kind of how you thought through the timing of whether or not to get an MPH before looking?
Sure. Maybe it wasn't the most conscious decision, but looking back on it, I don't regret not going directly to get my master's in public health right out of graduation. I think if it's the right choice for you, that's great. But I feel like I've gained really valuable experience in the workforce. And it also has a lot to do with financial reasons. It's really hard to go right out of school if you're already taking on student loans. So that's also a huge piece of, I think, why people make the decision to go later down the line to find an employer that will help them get that degree, or just that's sort of my thinking.
Yeah, fantastic. Okay, can we go on to Sally Kirshner for your question?
Hi, can you hear me? Yeah, great. So I just want to point out, Cindy Ingham and I are on this call. First off, I want to go back to what Jay was saying. I was a health department employee for many, many years. I got my master's in community health nursing at UVM through I had 80% of my tuition paid for by the health department. So many people did that, and it made such a more talented, skilled, learned workforce. It is such a valuable benefit. And so just there's a plug for applying at the health department. And then Cindy Ingham and I, Evelyn, you kind of hinted at this, is when people go into like clinical, like physicians, nurses, you get frustrated, you want to do something upstream. And there's always the profession of public health nursing, which many schools of nursing don't emphasize that until senior year, so the students don't know about it. So Cindy and I and some other nurses are forming the Vermont Public Health Association Public Health Nursing section to work with schools of nursing in Vermont, one of our goals, to highlight the opportunities and career choice of a public health nurse. And also, Dan, I assume you'll put a plug in for our annual meeting on April 29th, and at all the information's on the website, but we're having a public health nursing meet and greet at 4:30 for anyone who's interested.
Thank you, Sally. Cynthia.
Thank you. And Sally, thanks for the plug. I'm Cindy Ingham. I work for the Vermont Department of Health in a variety of capacities for 30 years, and I'm now the director of the New England Regional Genetics Group. My question is directed toward Noah and his last comment about being aware of how you represent yourself, whether it's on social media or in the community. And having worked for so long at the health department, I remember well the rigid guidelines that we had over what we could actually say in public about our opinions on a particular matter, particularly if it was political in nature. I'm guessing that some of the other organizations that are represented here may have the same sort of restrictions. So I would just like to throw out the idea for some feedback about what people think when they see something going on that's so egregious in the world of public health and of health. How do you work within the guidelines of your institution to recognize their communication restrictions and utilize your First Amendment rights? Perhaps this is something we'll talk more about tomorrow in the webinar on difficult conversations in public health, but we're in a situation right now that is unlike anything I have ever seen in my career. And I'd like to know how people can express themselves and stand up for what they believe is right.
Hey, Noah, you are on mute. You
Yeah.
can hear me.
I was just gonna say, obviously that's a great question. There's absolutely no easy answer to it, but the way I've been framing it at UVM and in our public health classes is that, public health is in itself political. And when you think through how our health happens, policies really impact that. And some policies are really good for health and some policies are really bad for health. And so I frame it in that context of how that is. And it's not in a partisan way, right? Because obviously, like, the whole point of our mission of public health is thinking about health for all, right? And that means no matter who you are, no matter how you voted, that you should still have the same and deserve like the right to thrive. But within that thing. There are some policies that are really bad for our health, and gutting federal funding for public health, taking away all the branches of the CDC and so many different divisions. All of that stuff is bad for everybody's health. And so I think you can talk about it in a way that's not necessarily, I'm not saying in the same political manner. I'm just saying that these policies and these actions are bad for our population's health. And I frame it in that manner. And I think by not talking about it or not discussing it, we do ourselves a disservice in our profession. We do our students a disservice, and we do our population's health a real disservice. And that's kind of the way I think through it.
I am sure that is a topic that everyone on this call would probably like to weigh in on. But just given the time, I'm going to try and wrap our panel up. But before I do, as Sally mentioned, we actually do have 2 events coming up. One is happening just tomorrow. We have a really fantastic workshop with Braver Angels, really focused on how do you speak across political divides. There's a lot of division right now in politics. People are stopping their engagement because I just can't imagine talking to that person who thinks something that's so egregious to me. And as a result, we're talking a lot less. And in the long run, I don't think that can be a good thing. So tomorrow's workshop, noon to 1, you can register on our website. We'll be really focused on how do you engage in those discussions in an authentic way. And last, on April the 29th, keeping with the theme of political discourse, is the question of misinformation. So we have an annual meeting. It's a fantastic event, a lot of different components, but one of them is a panel discussion focused on advancing public health in an age of misinformation. There'll also be a Public Health Champion Award. There'll be some great students with posters there and some socializing and networking time. So if you are a young professional or a student, a great networking opportunity, as there'll be lots of people from a lot of different Vermont-based public health organizations in attendance. So please do join us. And again, on our website, you'll find all the information. But please join me in thanking our panelists. This was really a fantastic, timely, important discussion, and just appreciate you sharing your both personal journeys through your public health profession and sharing advice on the landscape and how other folks may end up in your roles one day. So thank you very much to the panelists, and I hope to see all of you at another Vermont Public Health Association event soon.
Thanks so much for having us. This was really fun.
Awesome. Great.
Thank you, Dan.
Thank you, Mike. Thank you, Evelyn. Thank you, Noah.
Bye.
And thanks to all of our participants.